Today, I'll talk about menstrual cramps. This is a type of pain that affects teenage girls, women before or during their menstrual periods. I'll answer these 10 questions today. Are menstrual cramps normal? What causes menstrual cramps? Can menstrual cramps cause nausea, vomiting, and bloating? Where do menstrual cramps hurt? Are there different types of menstrual cramps? Can menstrual cramps occur after menopause? Is there any treatment to reduce the pain? Can I do anything to prevent menstrual cramps to occur? And what are the signs that I need to see a doctor? And do menstrual cramps affect my ability to get pregnant? And at the end of this video, I'll have a surprise revelation for you. So let's talk about menstrual cramps today. Before I continue, let me remind you that this video is not intended to give you medical advice. If you have pain that is severe or any emergency, call an ambulance or go to the nearest emergency department. This video is for educational purposes only. Are menstrual cramps normal? I would not say it is normal because having pain is not normal, but I would say it is very common. The technical name for menstrual cramps is dysmenorrhea. It affects a large proportion of girls, teenagers, and women. In some studies, they found that up to 84% of women said that they had dysmenorrhea in their life. But the number of women who had a severe dysmenorrhea that needed to take medications and interfered with their school or work was about 25%. What causes menstrual cramps? When the uterus is preparing to receive a fertilized egg, it accumulates a lot of blood to nurture the egg. But if there is no fertilization, then the uterus has to shed and release that blood, and this comes with muscle contractions. These contractions are triggered by substances called prostaglandins. However, if there is an excess of prostaglandins, it activates the nerve receptors in the uterus and the person interprets as pain. Can menstrual cramps cause nausea, vomiting, and bloating? Yes, and those changes in the digestive system are due to alterations in the hormones, and they can start even before the periods. Sometimes the nausea and vomiting is also because the pain is too severe and the person is stressed and nervous too. Where do menstrual cramps hurt? The pain is usually in the lower part of the abdomen, right where the uterus is located. Now, it is interesting to note that because the uterus is a viscera, the pain may radiate to other regions of the body, like the lower back, the inner thighs, the hips, and the knees. Visceral pain is different from skin pain. If I pinch you in the skin, your brain knows exactly where it is located because the person has lots of nerve receptors in the skin. Now, the viscera or internal organs are different. They do not have very specific nerve receptors like the skin, so the localization of pain is tricky. For example, a person may have a heart attack and the pain is in the jaw, the shoulder, the back. Someone may have a problem in the gallbladder and feel pain in the shoulder. That's why the menstrual cramp may radiate to other parts of the body. Are there different types of menstrual cramps? Yes, there are two types, primary and secondary dysmenorrhea. Primary dysmenorrhea occurs when there is nothing wrong with the uterus, there is no particular disease, it's not a sign that it's a serious condition or that it has to be investigated and eliminated. It is just an annoying symptom that recurs for months or years. Secondary dysmenorrhea is painful periods due to a medical condition. The most common causes are endometriosis, pelvic inflammatory disease, fibroids, adenomyosis, or polycystic ovary syndrome. Can menstrual cramps get better with time? Primary dysmenorrhea tend to get better with age and often improves after giving birth to their first child. Is there any treatment to reduce the pain? Yes, there are many things you can do to alleviate a painful period. First, try this. A hot water bag. I prefer a hot water bag and not a hot pad because the water bag is heavy and will press against the abdomen, reaching deeper muscles. Take an over-the-counter anti-inflammatory. As I mentioned before, the cramps are caused by an excess of prostaglandins. And anti-inflammatories, they block the prostaglandins. If the over-the-counter anti-inflammatories do not work well, then ask your doctor to give you prescription anti-inflammatories. There are many types of non-steroidal anti-inflammatory drugs, or NSAIDs. And if you try one and it doesn't work, then try a different one. For example, Profenid, ketoprofen, 50 milligrams tablets, or 50 milligrams suppositories, or 100 milligrams enteric-coated tablets. Ponstan, or mefenamic acid, 250 milligrams capsules. Ibuprofen, take 400 milligrams tablets. Naproxen, take 250 milligrams tablets. There are reasons for you to avoid aspirin or acetylsalicylic acid because it may increase the bleeding and it's not good to alleviate the pain from menstrual cramps. There is a medication called Midol, commonly used for dysmenorrhea, but it does not contain NSAIDs. It's only acetaminophen, caffeine, which is a diuretic, and pyrilamine maleate, an antihistamine to treat the fatigue and the bloating. You don't need to write down all of these names and doses. I did that for you. You can go to my website and download this handout. So next time you have a menstrual cramp, you can go to this chart and find out the names and the doses of these medications. Just go to www.drandreafurlan.com/medications. If you have a TENS machine, you may apply it to your lower abdomen or to your lower back. It produces electrical stimulation that competes with the painful impulses. Watch my other video about TENS applications. Acupuncture. If you have access to a person who knows acupuncture, then you may try it. The acupuncture needles will stimulate your brain's inner pharmacy to release your own analgesics and painkillers. In cases of secondary dysmenorrhea, the doctor may prescribe hormones like birth control pills or intrauterine devices to stop the periods. Can I do anything to prevent menstrual cramps to occur? Well, if you like this video so far, don't forget to subscribe to this channel and turn on the notifications button so you can get notified when I post new videos here. Yes, once the pain subsides, you may return to your normal physical activities, to school, work, and do not worry. Try to practice physical activities and exercises regularly. This will help your body to boost your own production of painkillers known as endorphins. Also, exercises help to reduce stress, worry, and anxiety. We know that when the person is more stressed, they release more adrenaline and cortisol, and these substances make the person more sensitive to pain. Learn some techniques like breathing, meditation, and yoga. Another factor that might help is good nutrition. A girl or a woman who lacks some vitamins and minerals is more likely to have dysmenorrhea. Deficiency of vitamin of the B complex are related to more menstrual cramps. They can be found in any healthy diet that contains nuts, seeds, whole grains, dark green leaves, cauliflower, beans, lentils, chickpeas, avocado, asparagus, and oranges. For any type of pain, it is important to maintain a good level of vitamin D. And also the minerals, magnesium and calcium, are important. A healthy diet is sufficient to give you all that you need. Watch my other video about the anti-inflammatory diet. This is what I recommend to all of my patients with pain problems, including dysmenorrhea. What are the signs that I need to see a doctor? If the person has one of the symptoms, they may have secondary dysmenorrhea. In these cases, the person will have other symptoms in addition to the menstrual cramps, like heavy periods, irregular periods, bleeding between periods, unusual discharge, painful intercourse, or bleeding after intercourse. Do menstrual cramps affect my ability to get pregnant? Well, painful periods, like in primary dysmenorrhea, does not affect fertility by itself. However, if the pain is caused by a secondary dysmenorrhea because there is underlying disease, then that disease may affect the ability to become pregnant. And here is the surprise revelation. When people ask me why I decided to become a pain doctor, my answer is because I had severe dysmenorrhea during my teenage and early adult life. It was only when I got pregnant with my son that my painful cramps disappeared. I had to miss school many times, and it was very annoying to have this type of pain every month. So what brought me to this profession was my own experience with pain. I'm grateful that I don't have them anymore, and I hope you get better too from this condition. Answer this question in the comment below. What works best for you when you have menstrual cramps? Share it here with other people. Goodbye!